Welcome back, beautiful tri-state area. You're listening to a moment of Zen right here on 710 WOR, the voice of New York iHeartRadio. I'm your host, Zen Sams. Up in just a few minutes in our Going Deep segment brought to you by CO2 Lift. Today we're featuring celebrity dermatologist Dr. Chaitra Anand, a global powerhouse in cosmetic dermatology. She is the founder of Cosmo Derma Clinics and Skin Q Derma Care, specifically tailored for skin of color. Dr. Anand's drive and passion have birthed establishments that today stand as epitomes of skincare excellence. Further enriching the world of dermatology, she's contributed through authoritative white paper and publications. Widely regarded as the Indian beauty guru, her influence goes far beyond clinics and academia. Her voice, amplified by her accomplishments, resonates powerfully within and beyond the borders of India, inspiring countless individuals to embrace their unique beauty. Today, she joins me to talk about secret hacks for skin of color. Now, you're probably not used to thinking of skin as an organ, but it's actually the largest organ of the body. It has a myriad of functions and is a big contributor to overall health. Skin of color requires some special attention to keep it healthy and attractive. It's prone to some conditions which are not typical of white skin, such as hyperpigmentation or the risk that skin cancers tend to be more advanced at the time of diagnoses. So, what are the best ways to take care of darker skin? Many people of color struggle to find good products for their skin, or they get bad advice from people who aren't experienced in treating skin color. Well, not here. Welcoming now to the show is the amazing Dr. Chaitra. Welcome, Stunner.
Hey, thank you so much, Zan. It's a pleasure to be here.
Absolutely. Congrats on all your success. So excited to have you on. And I just want to dive right in because we're timed and I want to get as much information as I can out of you. So, what are some of the inflammatory conditions one can experience with skin of color?
You know, I'm really glad that you're differentiating skin of color from other skin types because I just think that we don't have enough conversation about it. There is a big awareness, but there's a lot of underrepresentation. Now, skin of color typically, like you said, tends to be more inflammatory, right? So it's more reactive. So something as small as like an insect bite or just a small nick from your nail can actually lead to more long lasting pigmentation. So, first and foremost, the skin of color always reacts by hyperpigmentation, and then the healing phase sets in. And a lot of times, if this hasn't been attended to early on, the hyperpigmentation can be long lasting because we call it as post inflammatory hyperpigmentation. And that's the worst thing that can happen in skin of color, really. So, that's the most inflammatory problem that we see, which is very common with skin of color. We also see that healing time tends to be a little delayed. And the reason for this is just because of the way the skin of color heals. It has to do with the hydration content, it has to do with the thickness and the thinness of the skin quality, right? The upper skin and the lower skin that we talk about. It has to do with the differentiation in the collagen that we produce in skin of color, and also finally the oil or the seborrhea content. So all of these are contributors to this. So delayed healing, hyperpigmentation are the two common inflammatory conditions that we tend to see. And in the younger skin group, right? Like, people who are in their teen and even preteen going into their 20s and 30s, because of the seborrhea content in skin of color, we tend to see a lot more breakouts and acne, clogging, comedones.
So, the age where these conditions typically present themselves, you would say, are in the teen to early 20s.
Yeah, the moment people have skin of color, you know that you have to take care of your skin even in your preteen years, because if you don't, that's going to have the post sequelae of PIH or post inflammatory hyperpigmentation long into your adult life.
So, how would you treat skin of color inflammatory conditions and hyperpigmentation?
Very carefully and very gently, because the first thing that we think about with skin of color is to calm down the skin. It's not about throwing everything at it and getting aggressive and getting it out of the way, but it really is about getting the skin conditioned. So it always starts with skin conditioning. And so we first thing we look into is what is the cause, what is the effect, and what is the routine that the person has. And it's very important to get into a skincare routine for any kind of inflammatory condition that we're treating with. I'll give you a clue. We always talk about a 5-step program with skincare for skin of color, right? The first becomes as basic as a cleanser. So we talk about just using a pH balance cleanser so that we don't irritate the natural skin pH and we keep it intact. The second step we talk about is really about nourishing that skin and keeping that skin barrier intact, because the moment the barrier breaks down, it leads to water loss, which will again dehydrate the skin and cause the skin to get sluggish in its healing. So again, it's about skin barrier repair. Then the third step is protection. Now, a lot of people think, oh man, I have skin of color, I have some protection in my skin, maybe I don't need a sunscreen. Not true. In fact, skin of color needs vigorous and rigorous skin protection, because if not, inflammation from the sun and radiation leads to hyperpigmentation. So sunscreen is step number 3. And step 4 is what we call as the repair step or the treat step, where we'll use more active ingredients, prescriptive creams based on what we're targeting. And then the 5th step is what we call as a boost, because every week we need to keep that skin stimulated, so that's a gentle exfoliation, etc. So this is what we get into as the basic for everybody with skin of color. A 5-step skincare regimen, super easy. Once
Super
you've done,
easy. This is super easy. Well, I want to kind of shift a little bit because I don't want to get too stuck on that 5-step process, because you talk a lot about the importance of hydration. So why is it so important to keep your skin hydrated in skin of color, and how does it affect aging? And of course, you would say, does drinking water alone help to keep skin hydrated? So those are my immediate questions.
great question. I'll start backwards. Drinking water is great, but you have to understand that skin is a reservoir of water. And when you have excess of water in the body, then it gets stored in the skin. The skin is the last place that the water goes to. It goes to your blood, it goes to the heart, lung functions, etc. So just drinking water is not enough. It's important. But what is more important is sealing the skin surface, be it on the body or on the face, neck, because even when we're sitting, right, you're sitting in air conditioning in the summer or in the heating in the winter, the skin is losing water because the atmosphere is pulling water out of the skin. So you always need to use something like a humectant, like hyaluronic acid, sodium hyaluronate, etc., to keep that skin barrier. Now, because the skin is made of oil and water, and when these two combine, they form a film, and that stops the dehydration from happening. And if skin is hydrated, it has what we call as life force in layman's terms. And so it's able to heal, it's able to stimulate itself, and it's able to repair itself.
And it looks fabulous. And I always add coconut water to my list because it's truly proprietary in its health benefits. Potassium, calcium, and magnesium, those are all the electrolytes, and they play important roles in helping maintain heart health, liver and kidney health, digestive functions, and healthy blood sugar levels. Of course, you can't forget muscle and nerve functions. And my skin looks incredible. I love coconut water because it does actually keep my skin very hydrated. And my favorite brand that I've been using these days is Once Upon a Coconut. My daughter loves it. They have incredible flavors. But I want to move on to another important segment here, where so the sponsors for the segment CO2 Lift, Carboxy, have a gel that from their studies show 117% increase in hydration after only one application, as well as 26% increase in elasticity after 6 treatments. And this type of hydration is optimal. So when we talk about carbon dioxide therapy for the skin, it almost feels exactly like what you're talking about, that hydration, that barrier. How do you feel about carbon dioxide therapy for the skin, what they call carboxy therapy gel?
I've tried the product and we use that. It's phenomenal, especially like even post procedure. We use it a lot more in post procedure. The reason is that after the procedure, the skin is inflamed, right? It's got redness and it's like there's more blood vessels there. So, flushing of the blood, etc. This these carboxy gels are phenomenal. They just calm the skin down, and you can immediately see that the redness comes down within 20 to 30 minutes of application, etc. And what's really great about products like these are they're good quick fixes, but they're also great for like routine care. Now, aging is at sets in at 25. Till 25, you have young skin, but aging sets in at 25, and depletion of water in our body and in our skin, the hyaluronic acid depletion starts there. The moment there's hyaluronic acid depletion, there's decreased collagen production, poor elastin health. And that's why something like the carboxy gel therapy will help keep that revigorated and regenerated.
I love what you're saying. You're speaking my language. And of course, when you're talking about increasing the presence of wound repair factors and growth factors, which in turn help cells turn over faster, and this carboxy therapy gel, of course, also reduces the appearance of aging and scars and stretch marks. I've used it for a list of issues that I've had. But more importantly, regenerating and repairing damaged tissue was important to me because people want to have better looking and better feeling skin. So the repair process in the CO2 Lift product was extremely important. Now, as a dermatologist and one who advocates female empowerment, how do you feel about vaginal skincare?
you know, I think we don't talk enough about down there, so to speak. People do shy away from the subject, and I do feel that now women are owning up to it. They're getting more and more confident to talk about it. Because Skin of Color always talks about pigmentation, there's been a lot of talk about, whitening and all of that kind of lightening products, etc. But people don't understand that even vaginal skin gets dry, especially in the 30s, right? Mid 30s onwards, as our estrogen changes, estrogen levels go down. And then there's a lot of dryness that happens. So using hyaluronic acid products, using products that are hydrating in that area actually are really great.
Yes, you're right. Down there, even at my age, I'm in my late 30s, but I've actually used the CO2 Lift V because it lifts, it hydrates, and rejuvenates in just like 3 applications. And for me, it helped tighten and lift it all down there, basically with carbon dioxide therapy. So it was so simple. It enhanced circulation. It's really quite an effective method. It rushes oxygen-rich blood to tissue and regenerates cells to improve sensitivity and lubrication. It's quite phenomenal. And so I'm a big, it's non-invasive, which I love. I love non-invasive products. Now, I want to shift, and this is important. We have 2.5 minutes left, but there's a pervasive misconception that darker skin types do not need sunscreen protection. What are your thoughts on this?
In fact, I would say we need sunscreen a lot more than other skin types do. The reason is we're all predestined to going towards hyperpigmentation with Skin of Color. The only way to block that is prevention. And the only way to prevent is really to use consistently a good sunscreen. So I tell everybody, start young and get into the habit. And I always tell my patients this then, if there's nothing you do and there's only one thing that you're going to do for you, then just use sunscreen consistently. And 90% of the damage that happens to Skin of Color over a period of time is because of the UV radiation from the sun. So sunscreen is really actually the best anti-aging product too.
Yeah. Not only for darker skin, but even for white skin. I mean, where would we be without, sun protection? Because sun damage does not discriminate and can affect all skin types. It can negatively affect Skin of Color, like you said, causing that hyperpigmentation, rosacea, melasma, cutaneous lupus, photoaging or wrinkles. And these are common skin conditions, but it's imperative that a broad spectrum SPF, at least 30 plus sunscreen, I would say, regimen is implemented in all Skin of Color patients to protect against the harmful UVA and UVB rays, because sunscreen is especially important if you plan to be outdoors for a long time. And even if you have minimal sun exposure, without adequate protection, damage, to your point, accumulates over time. So thank you for pointing that out. Well,
I'm
we
just
are
gonna
yes, go ahead.
I'm also going to say that, in Skin of Color, you need a little bit more added protection. So using topical antioxidant like vitamin C with the sunscreen is really helpful too. So you could use a sunscreen, which is broad spectrum, like you said, SPF 30 minimum, but look for a PA factor also, because broad spectrum means UVA and UVB. So it's SPF plus PA rating of at least a 3 plus, and then built in with an antioxidant like vitamin C is a bit more of a total protection.
I love that last part. That this is why we have experts like you, because I only know enough. You know that extra. Well, thank you so much for coming on.
Pleasure. Thank you for having me.
That was our Going Deep segment brought to you by CO2 Lift. That was celebrity dermatologist Dr. Chaitra. She's an award-winning celebrity cosmetic derm. You can head directly on the gram at dr.chaitra with a Y. She's an Indian skin and hair expert, founder of Cosmoderma, and creator of My Skin Q. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. Head to CO2Lift.com. It's an in-office or at-home treatment that delivers CO2 cutaneously over just 35 minutes. It's transdermal, non-invasive. It's a simple facial mask recommended for post-procedure care after invasive procedures such as needling or laser or pretty much anything. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this.
A Moment of Zen is brought to you by CO2 Lift. As we age, our skin loses moisture and elasticity, causing wrinkled skin. You can reverse this aging process with CO2 Lift. CO2 Lift utilizes the powerful benefits of carbon dioxide to lift, tighten, and regenerate your skin. This simple, painless at-home carboxytherapy treatment is scientifically proven to reverse the aging process. You will see reduction in wrinkles, increase in luminosity, and improve pigmentation, sagging, skin tone, and radiance. For more information or to order CO2 Lift, go to CO2Lift.com.